Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. In continuing our discussion on medications in people with intellectual and developmental disabilities, we're going to talk about medications and metabolic syndrome. So metabolic syndrome is a cluster of conditions that can increase the risk of heart disease, of stroke, and diabetes. And some of the core features of metabolic syndrome are central obesity, meaning in the center part of the body, especially the abdomen area, elevated triglyceride levels, a low HDL, which is the good type of cholesterol, high blood pressure, and elevated fasting glucose levels. So a grouping of these symptoms together is what we call metabolic syndrome. And there are a number of medications that can increase the risk of metabolic syndrome. One of the biggest classes that we see this in that's heavily used in people with intellectual and developmental disabilities are the atypical antipsychotic drugs. These drugs are sometimes used to treat mental health conditions. Sometimes they're used to treat behaviors. And if you've heard our previous talks, we've talked a good bit about being cautious about doing that. But these particular medications can increase the risk for metabolic syndrome. Other classes of meds include some of the antidepressants, some of the anti-seizure medications, some diuretics, some beta blockers, niacin, some oral contraceptives, and a few other medications. The important thing is to know which medications can increase the risk of metabolic syndrome, and if a person is on these medications, to monitor for these symptoms. If we see a person gaining weight, if we see that their triglyceride levels are becoming elevated, or they're having high blood pressure, or their blood sugar is starting to become elevated, we need to be very, very cautious of these things, and the medication may even need to be discontinued. So be aware of medications that can cause metabolic syndrome. Know what metabolic syndrome is. Talk about this with your team, with the clinicians who support people with intellectual and developmental disabilities. You may need to consider routine testing for things like blood sugar and blood pressure and weight and all of these different things. So use caution when using these medications, and do what you can to help reduce overuse of medications and reduce the risk of metabolic syndrome in people that you support.
Hey everybody, thanks for watching this episode of Medical Mondays with Dr. Craig Escude. We got a ton more in the backlog, so if you want to check those out, we got a playlist on YouTube, or you can listen to it on our podcasting platforms. We just want to make a quick note that Friends for Life is currently hiring, so if you'd like to come work with us here at Friends for Life, head over to friendsforliferc.com, go to our employment page, fill out the form, and we'll get back with you soon. And we also have a new show airing now called Nursing in No Time, kind of as a complement to these Medical Mondays. So if you'd like to check that out, also available on our YouTube channel. And as always, you guys can check out the Friends for Life podcast and our midweek minis. So thank you for watching. We'll see you next week.